Hello, Naked Parent Nation, and welcome to today's episode of the Naked Parent Podcast. My name's Chad Ratliff, and I'm your host today. And today we're going to be talking about how every child with autism is different. If you didn't know that before, we're going to talk about it and get in depth with neurodiversity and what that means. But before I introduce you to our guest today, let me start by sharing our community's preamble. Naked Parent Nation is a worldwide community of parents raising children with all kinds of needs. We come together to share our naked truth, support our fellow parents, and inspire the inner growth that each of us needs to build the life and family of our dreams. For the parents that are struggling, we will love you until you can love yourself. For your children, we pray and send power from our collective group. As we come to understand our divine nature, we realize that there's no need to feel sorry for ourselves, be angry, or feel lack. We come to understand that our feelings of limitation and separation are only in our minds. Through self realization, we expand our consciousness so that the challenges that perplex us today dissipate one by one until we're able to see and experience gratitude from every inch of our lives. We will lift you up until you're in love with your life exactly as it is, realizing you have the power to create any kind of life you want for yourself and your family. We do this by living in the naked present moment, one day at a time. Esther and Jerry Hicks call it the science of deliberation. We call it the answer to all of our prayers. So let us continue our journey by introducing you to our guest today, Dr. Anila Khan, who comes to us as a clinical psychologist and speech therapist and psychotherapist. She's been in the field since 2011 with children and adults and developed an expertise in autism, and just has recently come to find out that she is neurodivergent as well. So, Dr. Khan, welcome to the show. We're so grateful to have you.
Thank you so much for having me, and thank you so much for providing me the platform to discuss my and to share my experience with these children. And I must say, these children are lovely children. These children are divine children, and they give you the experience that is something from outer world. So let's start with that thing. Let's start with a positive note, because there's a
Yes.
lot of negativity in the environment. There's a lot of they can't do this, we can't do this. Let's talk about. I would like to talk about what is the positive aspect of that thing. What is the positive aspect of parenting these children, and what is the positive aspect how we can create a supportive environment for them and for our own self. So we will let's talk about that thing, not about negativity. I'm sure nobody want to listen negative things all the time. We can't do this.
No.
There are a lot of sensory issues, digestive problems, and sleep issues and stuff like that. So thank you so much for having me.
Okay, so can you tell? Can you tell us how you came to this profession and how you came to find out about your neurodiversity?
Okay. uh, in 2011 I was doing my graduation. I was doing BS psychology, that is a plain psychology field. And in that we are supposed to take few cases for our internship. I was doing some internship and there I visit a center, and they have almost 170 180 kids in their parameter, and they have 7 to 10 autistic children in the classroom. So I asked for a child case, and they asked me to just to give some introduction. So as you know that you already told that I'm too much passionate about work. So when you're a neurodivergent person, then you're too much obsessed about the thing you are doing at the moment. So at that time it was, for me, was the study. And I always like to study the history of things. So whenever a topic is presented to me, I don't understand until and unless I go in the depth. So if it's one topic, then I have to study the whole topic, the whole history of that concept, so that I grab that concept. That's the reason my concepts are still very clear about everything. So nobody could challenge me on this concept. That's the positive aspect, and maybe that is the thing that is giving the confidence. So they asked me to write something about ABA. So at that time, we just recently studied the ABA. So I write everything I know about ABA, and even I was asking from pages to pages. Just give me, I will write more and more, because because I talk fast. Maybe you observe that as well. It means that my thinking is very fast as well. So whatever was in my mind, I was writing and writing and writing. Then they asked me to join their institution. I said that I cannot join recent at the moment, because I'm about to complete my education, about complete my degree. After I complete my exams, then I will come. So the moment my paper was finished, the next day I went to that institution and I start working with these children. And when I went to that place, the whole world was new for me, because first day they asked me to sit with almost 10 autistic children in one class. So we were three teachers in the class, and there were two children who were new to me, and they tell me just to control this kid. For me that was a new word, and that was a different thing for me. And from there I know that what is autism. And at that time even I was not even familiar of that term. uh, uh, they just said that these are autistic children and just work with them. You could say they have behavioral issue, they can't sit on the chair, they have no sitting span, they have no attention span, they have no language, they have no communication, they have no emotional expression as well. And I learned these things, these professional terms, but which I'm telling you with time, because when you work then you have to go to the all process. So there's that was almost 5 to 6 months with these children, and that was amazing for me. That gave me a lot of experience. Over there I learned about autism, I learned about ADHD. And the problem was that I was supposed to know these things before going to that place. That is the issue with our education system, because we have a, maybe you know that we have a diagnostic manual which is called DSM-4. At that time we were studying DSM-4. In that DSM-4 they just give you two three things about children, that they are intellectual disability, they are like they are mentally retarded children, like Down syndrome, and then they are slow learner. So that was two categories that was taught to us, or the teacher told us about that. And what is coming in between that, we never know about that. And what is learning disability, we don't know about that. So with passage of time, when we I just started working with them, then I was so much interested. Then I asked them to train me in ABA. I asked them to train me in speech therapy as well. At that time I didn't took my diplomas, and I didn't even uh, went into becoming a psychotherapist. So that was start for me, and from there I get a lot of because the motivation to work with these children, because when they are a little bit stubborn, then I'm stubborn too, in the sense that whenever they give me the task, I make sure that I do that work with honesty. I make sure that that child supposed to write by himself, or the child complete his work. So that was my start. So that's how I came into that field. And and the thing was that when I started my professional training, then I was the only person, the only student in the class. It was 25 of the 25 girls in the class who was dealing these clients, first hand dealing with these clients. Like I was the one girl, like who was taking patient from the and I faced a lot of trouble at that time as well. So that is my journey, that's how I started. So when I came into that field, then the training goes and goes and goes, and my interest developed in speech therapy. In assessment, I'm very good in assessment. I study a lot of about different development tool, because whenever we talk about this country and we talk about your country, then our norms are different. We are not over here following the arithmetics, or we're not following the mathematics in the sense that boxes, or the concept of puzzle fixation. About intelligence test, that you need to fix the puzzle and you need to arrange these things. In Pakistan these things are not common. So that is not the way that you need to assess these children. But the challenge was for me that how I'm going to assess these children. So then I study about developmental milestone, that how can you can do informal assessment. That there are a lot of assessment that you can do there. Binary social maturity scale, how you could do their skills assessment. So that if you're not able to give some figures, but at least you give them a elaborated diagnosis to these children, so that it could help the children to understand. After when I was working with assessment, then I came to know the concept of individualized educational plan. That was very novel thing for me. And with the passage of time, when you work on individualized educational plan, you learn a lot of things, that you need to add things, that this thing and that thing. So with passage of time, I worked with this patient, and every day was different for me, because there was when I was taking in the start, if there was 7 students in the class and everybody saying they have autism, then I was saying what is the difference between these all. And I used to ask a lot of questions, and they get so scared from me, because even they were not facing me, the owner was not facing me, because whenever he will see me, he said that she will ask me question, and I was not able to answer that question. Or sometimes he will divert me to some other person, that go and ask this question from that person. and I would get confused if I'm not able to teach a child a concept, if I'm not able to teach a child a word, a picture, that what strategy could I use? So that's how it started. So the
That's
journey is
awesome.
still going on. I'm still learning phase.
Yeah. And then how did you what made you think to uh, check your own assess your own
Okay, so
neurodiversity?
okay, okay, I will come to that. But then I went for speech therapy. I went for I was becoming psychotherapist at that time. That we have some training for 1.5 years in Pakistan, which we call advanced diploma in clinical psychology. I did that. Then I did other trainings, like I went for speech therapy and stuff like that. So when I was in the class, throughout the class, throughout my educational career, I would love to run. I don't want to sit in the chair, and it was so difficult for me to sit in the chair. It was so
Yeah.
difficult for me to sometimes to listen to the teacher, and sometimes get lost as well. I'm not saying that I was a very good student. Whenever I pay attention to something, then I would learn that thing very well, because like I was very good in mathematics. But whenever it comes to some advanced things, then something I used to forget things, and I get lost on that thing as well. That why I'm not able to learn few things, why I'm not able to memorize few things. So that was a thing which was giving me a lot of trouble. Then I have, I guess, some form of learning disability in the sense of dyslexia, because I was not able to formulate the right spelling. I got a lot of grammatical mistake, and it would give me, a lot of trouble at that time. That why not able to understand the grammar. Till now date, I don't understand English grammar that well. Till now my spellings are very poor, I know that, and even I don't change them. I'm proud of them. I don't want to change this spelling now, because if you're getting my point, if you understand what I'm writing, then it's okay. If you go to my
Yeah.
page, I will give you the link of the page, then you will see the grammatical error. Even I'm doing in three languages. I'm doing in my Pashto, in Urdu, and English. I'm writing my, I just write in English, and then I do that in three languages, translate that in three language, two languages more. So English was challenge for me. I was not able to pronounce few words. That was very challenging for me, and I was not able to read words properly. So even if you're talking to me, I would miss the word. Like even if it's a song, I would say wrong lyrics of that song. So that was very thing for me. And teacher used to say that whenever we are talking to you in the class, you are very brilliant, you're very bright, but whenever it comes to your grades, sometimes it's decline. And I don't have the answer for this question. I was because I don't. It was like I was not interested at that time. I want to play all the time, maybe. So that was that, and I was the kind of person who will only study for getting pass in the exam. But meanwhile, I also took a lot of positions as well. It's not that I cannot take position. I know I can take position, but that was a mixed journey. English was trouble for me. I was very good with mathematics. I was very good biology, and I was very good fine arts and art and stuff like that. And I was always have the you can say the you could say I was always hungry for knowledge. So I used to read a lot of books, and that was so fat, that kind of books. Like, and sometimes I used to read one book in one setting, in one go, if it is that small book. So it was like that. So that was all our mother tongue, that was in Urdu. So even then, till date, now I'm very good in Urdu. I know very difficult words in Urdu. I know their meaning in Urdu. Till date, people don't know about the meaning of that, but I was very good in that. So even till the university one day, it was literally gave me a panic attack that I'm going to fail in English, and somehow I got secret in that. So language was something. English language was something I always get very good marks in mathematics. I will get good. I will score very good in physics and chemistry. Biology was very good with me. I was very good in biology. So because it was medical and life field, so it was like that. But memory was issue, main thing for me. I used to forget things. So even I was, but literally later I discovered in the university, because in university that was the time I was facing a lot of issues as well, because in meanwhile I faced a lot of other kind of issues as well, psychological problem as well. That is a, you could say, that is a plus part when you are neurodivergent. You face a lot of problem, you face a lot of, you question a lot of things, and you don't even understand, because all the time you get that it's my fault. And I will tell you about socialization, which was totally zero. No friends at all. It was only one friend all the time. And whenever that friend will never come, and I will feel so alone. And I don't understand. At that time, I was not able to understand that how to talk to other people in a sense, because I will feel so shy. I was shy, and sometimes if I will see a lot of people, then I will cover my eyes. And whenever there's a new place, then I will mute. That is a kind of selective mutism. I will not talk in that places, and I used to talk very fast. So university gave me very different experiences. Even one day, my HOD called my uh, elder sister, and they give this communicator. They give the message to the other girl that is she having some kind of problem, because when you are having a lot of issues, you don't understand the situation. Obviously, you're getting in depression, you're getting in anxiety, and a lot of things going around you. So that was the thing. In the university, it was very difficult for me to uh, make friends. That was always one friend, and the problem was that when that girl get to the other group, so I was alone again. And in university, there you have to give presentation in the group, and I was so empathetic, I was so helping in my university that I would help everyone. I will go to everyone. I will make their assignment because I was very good with technology. I was very good with computer. I was very good with helping other. Like I was learn very fast things because I was very good whenever it comes to skills. That's the reason I know a lot of skill from cooking to baking and stitching and stuff like that. So I used to help everyone all the time. But whenever times come to me, then there was no one to help me out. So in my university for maybe 2 or 3 years, I was the one giving own presentations. Like group projects, my group projects was alone, presentation was alone. And I remember my first day in university that I was not able to talk to the teacher. She asked me to introduce myself in English, and my voice was here, it's totally here. And all the time in university, they will stop me all the time, why you're talking so fast, slow down, slow down, slow down. And that was so you could say so annoying for me, that how could I slow my speed. Even sometimes they will record that thing on the mobile, and they will show me that look at your speed, it's so fast, just talk slow, talk slow. And in sometime in presentation, there was a girl standing beside me, and she will continuously reminding me, talk slow, talk slow, talk slow. So there was a lot of issues. So when I came to, when I was becoming the clinical psychologist and psychotherapist, at that time my trainer, he gave me a very tough time, I must say, because if you're a if you're divergent, you got a lot of temper and tantrums. Now I'm some form of a different form. Before that, I got a lot of anger issues, a lot of temper tantrums. Whenever he used to say something to me, I would shut the door so far, so hard, so that everybody listen in the class that I am angry. And not just that door, I will close the door, the outer door as well, so everybody listen that I am angry, why he snubbed me in the class, why he said this thing to me. So he used to make fun of me in the sense, yeah, do you want to see any girl with the ADHD, the girls who don't sit on the chair, and the girl who is always sitting in the edge of the chair, and the girl who always want to raise her hand and talk before the, because I know the answers, because I was good in the education, so I know the answer. So all things was indicating toward me. But then recently, I started 2 3 years back. I started podcast or a Facebook live session. Then I started studying about autism in girl. Then I understand that before that I knew that I am different, but how I'm different, that was the reason that the girls who have autism, their mind is working like a male child. Like autism girl and male child mind are same. So then I come to know that why I'm the one who take a lot of risk, and who is doing difficult tasks, doing decision making, and making difficult goal for herself, and achieving those goals, and don't listen to the difficult circumstances in their life. So that was the point when I tried and starting understanding. Then I uh, studied a lot about neurodiversity. Then even I was telling one thing to my friend yesterday, like it was about headphones. I don't go outside without headphones. It is very necessary for me because I listen music all the time. It gives me relaxation. So whenever I go outside, there are two must thing with me. That one is coffee, my coffee mug, and the other is my headphones. And she was laughing that yeah, you have autism as well. So that was the point. So that is the point when I came to realize that I am neurodivergent, and a lot of things start making sense. And my guilt was I come with my terms to my personality a long time ago, maybe 2 3 years back. But with the passage of time, I'm getting change, and the positivity is something that is coming from inside. And I realized that whenever you make a goal in your life, then you have to achieve that goal, and you don't listen to because life as a journal is difficult for girls in Pakistan. But when I talk about autism, still I don't, maybe I don't need friends now, because I'm too much passionate about my work, and I work all the time with the children. And my, because there's a lot of things that how you can overcome a lot of things, and that things which I learned with the passage of time, which is very important for other people to understand as well. So whenever it comes to these things, I am so easy to answer and to give a satisfactory answer to the parents, and they listen because I talk truth. And one thing which I follow in my life, that rule is that always tell the reality to the parents, what is the condition of the child. So the one problem which I face as a friendship as well, that I'm too blunt. So you have children, so you also know that those children, people who are neurodivergent, they're very blunt. So it's a big journey. Maybe we need a lot of time to wrap this thing. Maybe I wrap this thing so quickly.
Yeah. So so what does your work look like from a day-to-day basis? Are you working with children? Are you working with parents? Are you work is the
Okay.
family come in? Tell us a little bit
Okay.
about your work.
Okay. So I'm basically working with children and adult both. Okay. So I am working with children, I am working with parents, mother, and I'm working with family as well. With child, when it is one-to-one session, okay, when we're doing one-to-one therapy with the children. And in PTMs, like parent teacher meeting, then I call the parents and give them, and even on daily basis I give report to the parents, to the children, to the parents, that today we do these activities, so repeat this activity at home. So whenever it comes to PTM, it is very easy for them to tell me that it was their progress and stuff like that. Then when I'm working online, I just recently I'm working online with patients with autism before Corona period, because I was doing some research with Canadian University of Sherbrooke, Canada. So at that time I get the idea that let's try the online one. So at that time I started, I was not even able to understand that I will do it or not. But I over there I get the idea that mother is an important figure in the child life. So why not work with the mother? So when I'm doing an online session, then you will find this video on my page as well. I will give you the link of my page. I just went post these videos so that other people get encouraged that this is how you can work. If you're not able to reach to the therapist, and you're not able to reach to the good therapist, then how can you work? So with mother is always sitting over there when I'm doing one-to-one session, that then I don't allow anyone to enter in the room. It's always about me and my child, because I the child which is I'm working, because I get distracted and I get very angry when I'm distracted. So I work with the child. And on online sessions I work with mother, and I ask mother to model me. So it is my instruction, and the mother is asking the child to do that. And a time came when a child is directly looking at me, they're directly following my instructions. And when I'm sometimes, just because of technical difficulty, the child is not able to see, then the child is not paying attention in the sessions. I just checked it a lot of time. So that is how I'm making relationship with the children. And I don't know how, but I'm very good with children. I love them. I love them a lot. So that's how I'm working. I'm with students. I'm working with teachers. I'm working with professional, and with children, with their parents, with their family. How to integrate. Even I'm going to the schools to integrate these children. In my from last 2 years, I was working with in a school, and I have almost 6 to 7 autistic children. And teach them speak, because they were you can understand that they were mute. Speech, first thing is speech communication, then I teach them how to read. Now few of them are able to read 3 letter sight words. That is a very big achievement for these autistic children.
Wow.
And there was one child who was having some kind of ear infection, so even there was a girl coming to me. She was a down syndrome, more like a autistic and syndromic child. So autism as well, because she's hyper as well. So it took me almost a month, because she was saying e for in our language elephant is hathi. So he used to say E for hathi, and I used to say E for elephant, elephant. So it took me a month, maybe more than a month, to break her this, that string. So her mother told me, when I talked to her mother, she said that when the child is not able to learn something in English, then I teach that word in Urdu. So now, after 6 months, integration of 6 months, the positive thing about that girl was, and that girl was on one word. She was talking in one word, only word, one word. And I just start with two phrase sentence, then three, then four, then five. And the thing was that she told me, "You're not going to take any about other ones in the class. I will come first." So that was a very positive development in that girl life. A girl who have poor communication skill, and now she is able to tell her wants and needs and desire, that she want to come first. She don't want the children to come first for with me and take the session. So that is how things are going. And whenever you put your efforts in something, then it's how it's results are coming. That is very satisfying for me. That is
That's
something
amazing.
else. That is something else.
Do you work with people like all over the world or in a specific
I'm work,
area?
No, I work all over the world because I have clients sometimes in Pakistan, in Islamabad, other cities as well. I work in other countries as well with those who need adult therapy. Basically, sometimes, like, mostly they come with depression and anxiety, or sometimes PTSD. So it's more like mixed thing. When you work with adult in the psychotherapy, it's not about the disorder. It's more about the personality. It's more about teaching the person the coping skills, because you cannot change the environment, you cannot change your circumstances. Whenever I talk to these children, these individuals, I give them two options. One option is change yourself or change the environment. Can you change the environment? We cannot change the environment. We cannot change the people. Okay, we change the people, we can change the environment, and we go to some other area, people come with the same uh, attitude with in our life again. So we cannot do this. So what we could do, with having our present circumstances, with our present issue, we can upgrade ourselves. So this is what I am teaching them. And it's a very good approach to them to understand their own thing, understand their own problem. In the sense, first they have to, when I start working with, owning their own experiences, and owning in the sense that they need to validate their self first. They need to validate their feeling. If they are feeling this thing, it means that it is coming from something, and it actually happened with them. So when they realize and they start feeling about that, then the exchange come with the passage of time. Then i then i work with making them more, in the sense, skillful to make their own decision. It's not like that they will always depend upon you, always ask me to do what to do. And I always give them choices, that it's your life. You tell me what you can do in this circumstances, what is best for you. So it's all about that. So it's a good thing that they are learning by themselves, and they, in the longer run, they will solve their issue by themselves. So it's how I'm working, and till now I'm working.
So, if for the parents that are listening to the show, they have a child with special needs, how do they know if they should reach out to you, and where do they go to reach out to you? How do they get in touch with you?
Okay, I have Facebook page, I am on Instagram as well. So these are two important, you could say. Social media is very, you could say, on social media you can reach out to everyone and everywhere in the world. So my page is Dr. Anila
So,
Khan. Should I tell you the name?
we yeah, tell us the name, but then let's make sure that we get it in the show notes as well after the show.
Okay, so my page name is Dr. Anila Khan, clinical psychologist and speech therapist. That is the name of my page.
Great. And how do they know that if they should reach out to you? So my child, say my child's 12 years old and they're
Okay.
nonverbal,
Mm-hmm.
they have intellectual disability and autism. How do I know if I should reach out to you to talk about my son or not?
Okay, so when you're talking about, it's very, you could say, in the start, parents are very confused about the issues of their children. Sometimes, if it's the elder child, then they will say it's our first child. Maybe we pampered that child. That's why he's acting in certain way. Maybe a lot of problems coming in out. That is about this screen, that we are giving too much screen time to our children. So that's how they develop autism, which is called Einstein autism. Maybe you heard of that term as well. So they are saying this, we are too much guilty because we did that. In the start, I always start working with the children, with working with the parents to lessen their guilt. Autism is not there, you could say, in our, in our region, it is like that. If you do something sin, then you're going to get that in this life. So it's not your sin that is coming to into your real life. It was a condition present in that children, maybe before birth, maybe after birth, and it was supposed to happen. It's not about the you're giving them mobile and not giving them mobile, giving them time, or giving putting your child on the caregiver, that they are not able to, sometimes used to say they are not recognizing us. The child is not recognized us. The child don't know I'm his father. The child don't know I'm his mother. So there's a lot of things are coming. So the point over here is that look in your community around. If every child on 12 years old is showing the same behavior, showing the same symptoms, not in the same sense of symptoms, okay. If a child is 4 years old, then child is supposed to maybe say 5 words, 5 letters, 5 letters, sorry, 5 phrase sentence. So it's a kind of global milestone for that children about communication. Okay, if a child is 2 years old and he's supposed to say these things, yeah, he's supposed to say 2 letters, yeah, 3 phrase sentence. So these are developmental milestone, global milestone. First check for these milestone. If you're not able to reach the internet, then check in your community that either your child is behaving exactly other children are behaving. If he is different, then how is different. Even you can compare your own children as well. You can compare these children with your neighbor as well. You can compare these children to your, you could say, your relatives as well. So that is first criteria. That's how you would know that. So then you start reading about that, and don't try to diagnose your child. It will give you a lot of tension. I know that people are coming and they are even before diagnosis they are so tense that, because a time came in my life, in my profession, then I talk about how we are going to work with these children. It's not anymore about diagnosis. What diagnosis is giving to you? For me, if I'm a professor, for me a diagnosis would be that I need to develop a certain strategy with the child to understand few things, to understand certain things. If a child is with autism, then I will go musical. You're getting my point. I will go musical because they love music. I will go in rhythms. I will directly, I will directly target the executive function of that child. So that is how it's giving me a guideline for treatment. But what guideline is giving to you if you diagnose a child with autism? As you're saying your child with autism. So you are wearing the glasses of autism and you are putting everything on that child because of that autism. Okay, let me give you another example how it's affecting the child if you sometimes self-diagnose a child. A mom was coming with me and she complained a lot about the child. The child is not doing that, and the child is not listening to me, and the child is not paying attention. The child is not communicating, and the child is not putting on his clothes and not eating. So I asked, "What about your other children?" She said that they're doing worse. So I told them, "You know that this child has a problem, so you're more focused on that rather than you should focus on the other children as well who could, when we talk about these children, uh, they don't, they don't leave a safe space. They don't leave a space around the mother. But what about the other children? If you go to some shop, that a child with autism, maybe he stay with you, but if a child with not he is not with autism, maybe he run away and he want to grab something. So over here you need to give equal time to both children. So that is a point which is very important, that in thing. And if you have some speculation that your child have, then at least once for once, take some professional advice about that thing, that your child have this issue or not, and not just take the advice, also ask from the therapist or the professional that what you can do about that thing, what you're supposed to do. But because when I always talk about teaching them the skills. For example, I would talk about self-help skill. What could a self-help skill about a child with autism would be? Independent eating. Okay, academics is something else. The child could learn academic very fast, like ABC they will learn very fast, phonics they will learn very fast, number they will learn very fast, shapes, because these are very common thing. My child know shapes, my child know ABC, my child know numbers, my child know everything. But they don't have functional communication. Why functional? They don't have functional communication because they don't have the vocabulary for functional communication. that is the point which where parents is lacking, and you are supposed to take advice from the therapist that how we can work on functional communication skill. Okay, if child is not able to talk, then we have other tools for that. The child can point at least. The child could tell you by pointing that he need that thing. The child could take you. The child could grab you to the thing and then put your hand on that thing that I want that thing. So then we work on that thing. And as you know that every child is different. So if five children are coming with me, then the strategy will be different. Even with same child, every day the strategy will be different. So they are so because their mind is working all the time. It's popping all the time. Maybe you have the theory about autism that they have some hole in the myelinated sheet, and the sensory sensation are overlapping all the time. So it's all the time firing off neurotransmitter all the time. That's why everything is jumbled up for them. So for that thing we need to make things easy for the child. So when we talk about treatment plan, then we talk about these things that how we are going to do that. But first thing is that you need to consult the therapist as soon as you observe the children in the community, in your own home and other community as well. Then and don't overdo that net, because net surfing is giving a lot of tension to the parents, and they themselves get into depression as well. So that is at the point that if you get into depression, then how you're going to uh, uh, how you going to work with your child? Because if a child is not 18 years old, he is your responsibility. So that is the point which I'm trying to teach as a parent, that first they don't need to take that you know the guilt of everything on themselves, the burden on everything on themselves. Plus we sometimes when people have such children, then they think that they cannot do more, child can do more. Yesterday I was in a discussion with a parent. They would know that was some institution working for with 30 years, and they said that we were doing sign language stuff like that. And I told her that don't go for sign language, because when you study the brain, then you know that the brain have the capability to overdo the brain, because there's a lot of area involved for a lot of things. For speech there are a lot of areas, there's not only one area. For emotions there are a lot of areas in the brain. For memories there are a lot of area in the brain. So the brain have the capacity to overpower that thing, and the brain even have the capacity to overcompensate that thing. So that is the thing, that if you give if you minus a thing from the child life, then they will not try to there for that thing. So if you put your child on the gestures and the sign language, in the sense that he will not go for the speech therapy, and like not go for the speaking, which a child could require uh, uh, if you do some effort on that child. When he will require, we don't know that thing, but if you work on the child, then according to my opinion, the child could acquire that thing. So that was too much from my side.
Well, that's a good thing the show is recorded, because I think we could. I need to go back and listen to it. You gave a lot of great tips and things that we can look at
Maybe
and
you
do.
can
And I
do it,
really,
you can post a whole program, maybe, or you can some small parts as well, 30
yeah,
minutes. So it is all depending on you.
yeah, we'll cut it. And like as we discussed, I think there's a lot of other discussions that we can have. There's a lot of
Yes,
areas
there
that
is.
we can dive deeper into in future conversations. But I appreciate all that you've given us on this show today. For the parents that are out there that are struggling right now, that just are feeling like there's no hope, or they're not going to make it, or it's not working. Do you have any thoughts of hope for them, or any experiences that you're having in your professional work that could give them some encouragement or
Uh,
hope,
you know,
just kind of in your
when we
closing
talk about
thoughts?
okay, okay, when we talk about autism, the main thing with autism is it is underdiagnosed and overdiagnosed disorder in the world nowadays. I If a child don't have language, everybody saying that he have autism. I told them that maybe there are 7 to 8 disorders in which the child can lack the communication. Even if we talk about Down syndrome, the child could have issue with the speaking. If we talk about learning disability, the child could have the issues. If that we talk about developmental delays, the child could have this issue. The CP child could have issue even with selective mutism, even those who have stuttering, even those who have logical problems. So there are a lot of children who have this issue. Okay, one thing I would like to say that when you talk about diagnosis, then also thinking about the thing that what you're going to do the next, because there's always hope, and hope will come with what, just try to think from outside the box, because academics is something that first think about that thing. What do you want your child to be? Do you want your child to be happy child, or do you want your child to be a robot? That is a true thing, because there are few therapies which are very aggressive therapy, and I don't like these therapies, sorry to say, which try a child to act like a robot, and child cannot act like a robot. So if a child is a child, he is a functional human being as well. So first thing is that what is the child's skills, that is important thing. But because when I'm working with a child, first thing, I follow the interest of the child. There's always something in which child is very good. For example, the child is very good with transport, then I will get that thing and I will use that thing. And children with more or less with autism, they like rhyming. So I will give you example of one of my students, and that will give you a lot of encouragement. The child came with me, he was almost 3.5 years, not 3.5, maybe 2.5 years old. And and he was talking and nobody was able to understand what he's saying. Second thing was that he always used to hide his eyes with the cap. And he was very cute, but he was all the time, he was too dependent as well. And dependency is what is worst thing for these children, because when we talk about therapy, our first goal is supposed to be make them independent. Independent eating, independent writing, independent self-help skills, personal self-help skill journal. So it's a lot of about independence, teaching them independence. So if a child, that child was too much dependent on their mother, and he was all the time sitting on the lap of the child. So I don't allow anyone to sit in the lab. I don't allow these things, because I was heading an institute, and it could create a lot of issues. Maybe that thing, because it's sensitive thing, that these could children could get into the situation of abuse as well. And I have treated such children in my past as well. So from that day onward, I don't allow anyone to take the child in their lap. You should maintain the personal boundary as well, and teach the child personal boundary as well. Because when we talk about giving them education, maybe it's whether it's sexual education, how would they know? They need to know about the boundaries, then we can talk about other things, that how we could teach them. So I was not allowing, that child was all the time sitting in the process, and I was all the time saying to all the teachers that don't make them sit in their lab, because he's already too much dependent, and he was taking bottle feed. He was getting almost 3 years old, and whenever we asked their parents to send the lunch, they would send the bottle with that child. So slowly when start working with that, and the child was very good with rhymes. He loved to sing the rhymes all the time. So I was applying, when I working with those children who have sensory needs, I use mirror therapy. Maybe you have the idea or not. The mirror is like that, they can see their reflection. So for those children who have sensory issues, like who are sensitive to touch, to sensitive to light, that if you do something indirectly, in the sense of in the mirror, that it's very positive for them, then they feel less threatened. So that is the kind of tip I'm giving you. If somebody want to talk about that thing, we will talk about that thing in detail later on. So I was,
Yeah.
we were doing that rhyming thing in front of the mirror all the time. So let me show the his gesture. It was like, A is for apple, apple. So I was doing that thing every day with him in the everything in the drill. So there were a lot of other activities which I was doing in the drill. So slowly the child came to, because he knew one words, but he knew words, but he was not speaking that clearly. He was talking English as well. So it comes to word first, then it comes to two phrase sentence, then it comes to three phrase sentence, then it slowly come to four phrase sentence. I was making videos and sending to his parents as well, and their parents were getting very happy. So after maybe 6 months, I was doing a session with the child, and he was exactly producing everything I taught him in the sessions. The same drill. So
Wow.
that is why drilling is important for these children. Now we talk about oral motor drill and oral literacy drill. It's not that why we're teaching everything to, when it's about repetition. Why repetition is important? Because whenever you repeat anything, then it is going to create a neural pathway in the brain. And when neural pathway in the brain, it become part of muscular memory. So the action become automatic. So if you have idea about the reflex action, if you see something hot, you take out your hand. So it's something like that. So I don't know people get this idea or not, but when we are talking sub skills, especially if it's about speech, so it's what how it's working. People don't get this idea that how it's working, why we're repeating all the time, and you're getting bored and stuff like that. So now he's going to the normal school. He has some issues, but I'm told you, he's the one. And you know what, when our children, I give you other example as well, because my 5 to 6 children are going to normal school, and I'm going to that school to check their performance, and I was giving them sessions as well. So these children were well behaved children, good command following, good sitting span, good attention span among other children in the class. If the class was of 25 of the class, 25 students, and they were the first student who would listen to the teacher, who would respect the teacher, and if the teacher said to them stop, then they will stop, and they show love and warmth to the teacher, and they will tidy up their lunch and stuff like that, and they will put the things from where they took. So what we want from these children, follow the command, which they were doing. But I provide that this therapy in individual setting, then we take to them to the inclusive setup, or normal schooling or mainstream schooling as well. So my point was that these children were well behaved, well mannered as compared to other children, and their love is so genuine. One day my friend, one day my our caretaker was saying something. She was talking about some children, and that children was some from elite class. And we have when you have a lot of money, you have a lot of privileges, then a lot of bad things came, in the sense the child start behaving, the child start misbehaving, in the sense that they know that nobody's going to say anything to them. So I was discussing, I think, and she was saying that the children is not listening to anyone. And what was going in that around in that club, that was kind of evening club, that every teacher is coming and every teacher is going, because they know how to tease the children teacher. And children run away because teacher run away, because a teacher cannot handle them. And if teacher would say something to these children, then they are getting roll call, in the sense explanation call. So I told them, just try one thing. And I asked her to, there was a child of 8 years old almost, and he was autistic, and he was humming, he was not non-verbal in the sense. He was saying something, but it was occasional, like he would say something for once. That is a thing with autistic children. He would say, and I just tell him, show her one thing. The child was standing alone in a room, and I asked her to wait in that place. And the child was standing alone, and that was table and chair, and he was waiting for me. And even I came outside, he didn't come outside, because he know that I asked him to wait, and he know that I will come back to that child, because that was our professional relationship, that was the relationship of trust that we developed during our therapy. So that's how positivity came for them. So that's how their things change for themselves. And if you have time, I will show you another case which is very important. So if you want to ask me question, then I will share that case with you at the end, because I'm working, so I have a lot of positive things to tell the parents, that that's how things change for these children when you start working with them.
No, and I appreciate that, and I think we definitely need to have a follow up conversation. But I appreciate
Yes, we
everything that
have.
you've given to the listeners today, and to me, I've learned a lot today. So I want to thank you for being on the show with us today. And
Thank you so much for listening.
will you send me the links to your pages so that I can put it in the show notes for our listeners?
Yes, I will give you. I will give you maybe on the on email ID. I will give you the link of my Instagram and my page as well. And whenever your stream is ready, then I will upload the stream as well. And I would like to do more shows with. If you will not, I will keep on mailing you and will ask you to do more and more.
All right.
Because
Well,
neurodiversity,
I'll
it
yeah,
don't leave anything.
we'll do that. We'll do that. But I enjoyed the first show today, the first of more to come. Let's say that, okay?
Yes,
And I wish you
yes.
all the best, and thank you for all the work that you do. Um, it means so much to us as parents.
And it means so much to me as well, because childhood is a age where you can do a lot of amendments if you go for early intervention. And these children are so beautiful, their love is so genuine, so warm, that and if you meet these children after 3 to 4 years, you know uh, they will recognize you. Let me give you one example. I used to do hijab thing uh, one day, and I was going to institution from the start. I told you about that, and I didn't work for that girl for a long time. Maybe it was 1 or 2 weeks, maybe. And that was going with her father, and she recognized me. She was saying bye bye. So
Mm.
that's how. Okay, and I was also working with a girl, and met that girl after maybe 2 3 years. And at that time she was elder as well, and when she came to me, she was mute. and somehow I work with her and I teach her to write, because I told you that whenever you start giving them some logic, then they follow the logic. So she know how to write, she know how to read, and she was also tracing with her hand as well, because I'm giving that a lot of sensory integration thing. So she was doing, and she was write the spelling as well. And I have few children who can read the without knowing the proper phonics. They can read the word because they can make the image and they associated the sound with the image, so that's how they can read, because maybe they're hyperlexic. So I went to that girl and she immediately recognized me and she came to me and she hugged me. So
Oh,
that is very positive thing. So that
very.
is something that give you, and they make you smile. That is the thing with their
Yes.
innocence, because they're
They,
very
yeah,
innocent,
they,
very innocent people.
and thank you. And thanks so much for everything today. Okay. And I wish you a
Thank you.
wonderful day. And I'll look for your email in the show notes and we'll talk more. Okay.
Okay, I
Bye
will.
for
Okay,
now.
I will email you. Thank you so much, and see you in the next. You could say live stream very soon. Thank you everybody for
Yes. Sounds,
having me. Thank you everybody for the patience to listen me, and see you very soon. I'm talking to my viewers. See you very soon.
we appreciate
Bye bye.
it. Bye bye.